we are very excited to present this webinar on this International Day Against Drug Abuse and Illicit Trafficking. A very brief introduction about Family First Guidance Center. We are one of a kind center which is situated here within the Juma Masjid premises of Bombay. We cater to the mental health needs of the community. We offer counseling services for pre and post-marital and psychological well-being. And in addition to this, we also offer matrimonial services as well as we offer financial counseling. So our aim is to bring together individuals and families to live meaningful lives, resulting in the upliftment of the community. A few ground rules for the webinar. You're requested to keep your mics on mute and the videos off. We will have a Q&A session at the end of the webinar. So everyone is requested to send in their questions in the chat box. So today's topic is on prevention of drug abuse. Drug misuse and addiction is a very prevalent issue in the society and especially in our communities. There is an increase in the usage of drugs for recreational purposes among the teens especially. And with so much pressure that teens have to experience to fit in, let's understand if they really do have to fit in with their peers. What's the right way to approach this? How can parents have a conversation and a dialogue with their children? What we can do as a community to eradicate this epidemic and prevent the usage and misuse of drugs within the society. So our speaker for today is Dr. Safiya. She's an eminent psychiatrist with over 17 years of experience under her belt. Additionally, she also has a master's degree in counseling and psychotherapy from Kuvempu University in Karnataka. Currently, she is a clinical director at Mind and Brain Hospital in Bangalore, and she is a member of several professional organizations, especially with Karnataka Psychiatric Society. She is also committed to community mental health. She's been involved in de-addiction initiatives, in mental health education, and in various emergency interventions with the government of Karnataka. I would like to welcome Dr. Safiya on this podium to help us understand this topic in detail, to help us eradicate the stigma.
Assalamu alaikum. So we all know why we are here today. And so much has been spoken about drugs and the drug abuse and things like that. So there's so much of aura around it. So people talk, okay, it's a issue this community, people are taking, teenagers are taking. So much of awareness is there around the people and in the media. So everybody talks about it. But then what we have to understand is, are we really aware of it? Meaning, how much do you understand the problem? And what do we do? Now, wherever there is a person with a drug abuse, maybe we go to a counselor, the school counselor talks to them, they are admitted in the rehabilitation centers, they are discharged. So this is what public knows. So this is what should happen. They should go to a counselor, then they should be admitted in rehab, and then they should be discharged, and there'll be a good life after that. So is it only that much, or is it beyond that? Is the problem deeper than what it seems to be? Is what something which we need to understand. This is the video emphasizes on the statistics and how much dangerous it has become. And the drug, initially we only think about alcohol, we only think about maybe cannabis, but it is beyond that. The kind of scrupulous drugs which is available in the market is unimaginable, and the accessibility to it is not even now, because of the phone, so easy for people to get it in so many forms that it is beyond our imagination. So it's very important topic for all of us to talk and to understand as a community now what should we do. So as a community, as Muslims, our needs are different, our approaches are different. So it's important to take a collective step. So we need to look at a macroscopic approach to it, where we look at from the community level what we can do, and a very microscopic approach, what should a family do. So community is built of families. Until we are strong as a family, we will not be able to do justice to the community. And when we work at a community level, then we can bring in a mass change. So that is what is the idea which I am going to talk today. So at family level, what we could do, and what community level, what we could do, and the medical level, of course, the doctors will do their job. So this is something which we need to understand before you even talk to a counselor, before even you talk to a doctor. A parent should be able to talk to a child. A child should be able to connect to masjid. At least they have some kind of a belongingness there. So that will bring in more result than going to a counselor or a doctor. So that's the logic with which I want to move ahead with my presentation. So one of the biggest barrier for the communication in the family, within the family members of the community, is the stigma. So the amount of isolation a person or the family would go through when there is a drug abuse is very, very, it's unimaginable. Nobody wants to talk about it. The moment, there is a person with an abuse at home, they are isolated, they are not in the part of the community, though they don't come to family functions. There's so much of stigma around it. So nobody has the ability to kind of openly talk about it. So they have to put it on the carpet and allow the problem to become bigger and bigger and bigger. And then when it is beyond control is when then they are admitted to hospital. So we have already lost a lot of time because of the stigma part of it. So we need to work around communicating, talking more about it, talking in our masjid, in khutbahs about it, that it is a common problem and there is help available and it is okay for things to happen, so that they can come for help, instead of they having to cover up, they having to not talk about it, and they having to go through this, in snowballing of the problem. So where are we now is that, as I said, we all know what it is, but we all don't know how to tease it further. And if a family member is suffering, they don't talk about it. And they suffer in silence to a point of destruction. They are destroyed emotionally, morally, spiritually, financially. They are destroyed in every sense. So it is our responsibility as a community to be available to each other and help each other to uplift ourselves. And the perception and attitude of the community itself is in a way negative. The moment there is somebody taking drugs, immediately there's a judgment passed that the person does not have iman, the family is bad, they are too modern, or they don't care about anybody, they're too negligent. So much judgment is passed, and we perceive it in so much of negativity, and the attitude is so bad that a person going through the trouble do not have any access to any help. So I think we need to change that to err is human. And in this, the way our society is framed now, anybody can slip. So let us not, we are nobody to judge. It's Allah who's the best of the judge. So let us not judge people who take the substance, and give them an empathetic hearing, a good listening, so that they are able to talk to us. Do not judge them. The more we judge them, the more they are destroyed. So that's something which I want to begin the discussion with. Please change the slide. So as we talk about the awareness, as I discussed, we all know a very dramatic story of a drug abusers, but we really don't know the intricacies of it. So being the outer layer is not what it is inside. There are so much of intricacies to it, and anybody could be vulnerable to it. It's not that only people from a bad family is going to be vulnerable to it, or it is not like, you know, somebody who is bad human being is vulnerable to it. Everybody is vulnerable to it. So we need to be aware that the risk factor is among everybody, and anybody can fall for it, and anybody can try to come out of it. So it's not that once a drug abuser, always a drug abuser. It's not that once a drug abuser is a morally corrupt man, or a morally they are somebody with no Islamic values. We cannot judge them that way. I think that is something which, as a community, we need to step ourselves up. So I am giving a very ideal model, and there are different ways we can kind of connect to a person who is in the using a drug. The first and the first person of contact is the family. If a person is taking a substance, the first person who should identify it is the family member, like a father, mother, brother. I'll come to the individual at a later point, what happens to the individual, what the complications and all at a later point. I'm talking from a community perspective. So family should be involved in the treatment completely. Without a family's participation and their involvement, we will not be able to take it ahead. We will not be able to proceed with any kind of an intervention. So their commitment and a non-biased approach is very necessary. As soon as we see somebody with a drug abuse in the family, do not throw them away. Accept them as a part of you, accept them, somebody who is diseased, and then take all the initiative to help them. And then we have to have the community participation, where we look into the workplace, we look into the surrounding where they are. So as a community also, we should, other than our family members, we need to be looking at others also. If at all you see someone else who is having a substance, they should be able to come to you and talk to you. It's like that. So we are also looking at volunteers, how we can have more volunteers at the community level who can also be helping us in recognizing more and more people who are under substance abuse. And of course, there are people in the rehabilitation centers who are admitted. Then there are people who are unemployed. So there are a lot of ways at which we can recognize people who are involved in the drug abuse. Yeah. So if you go to any of the rehabilitation centers, you will find this poster inevitably. Okay. So everywhere you will see the serenity prayer. So they, in the most of the rehab center, they kind of recite this every time somebody is there, and as a ritual of the morning practices, they start reciting these prayer. So it talks about the serenity to accept the things which I cannot change, courage to change the things I can, and wisdom to know the difference between the same. So here the concept of acceptance is given the entire weightage. It is not about the wrongdoing or shouting or preaching or nothing. It's about accepting the reality. We need to accept the reality as it is, instead of going back past again and again. First of all, the courage we all have to have is acceptance and whatever has gone wrong, and to be able to have the wisdom to see what I could change and what I cannot change, and work on the things which I could change. So this is the concept of the treatment of any drug abusers. They cannot go to the past. They have to be looking at the present, accept it, and then move forward and change what could change in the future. So one of the concepts which is extremely popular in the community is the concept of AA, which I am bringing it up here because this is something which all of us could practice at home as well. And all of us would start working in the community level as well. So first of all, we are having the ability to admit that the drug, even if you're working with a person who is a drug abuser or you know somebody, so our entire effort should be able to make them admit that there is a problem of drinking or drug abuse, and their lives is messed up because of that, and that is the biggest barrier of treatment. So because they do not accept it, they lie, they manipulate, they hide, they do so many things just not to admit, right? So the first step to intrude into the treatment protocol would be to admit that I have a problem. Once they admit that they have a problem, and then in the concept of AA and the concept of Islam as well, we believe that there's a power greater than ourselves who can help us. So submitting ourselves to Allah and then asking Allah's power to help us to help through this situation. So deciding to turn the lives around to the higher power, being extremely honest with our actions, admitting the mistakes and submitting to the higher power, and to be able to remove, asking the higher power to remove our faults, making the list of the shortcomings and making the amend to change it, and to kind of commit not to harm anybody and harm ourselves, and also help others when we recover. So this is one of the core theme of AA, which can be translated in all of our lives, where we admit our mistakes, we submit to the higher power, and we kind of, be determined to change, and then be honest about it, and also help others. So this is a concept with which we want to work at a community level, where we recognize more and more people with substance abuse and try to incorporate these kind of concepts into them. And then next level is take the medical help. Before you even go to a counselor, before you even go to a doctor, if these principles could be incorporated, we could bring in a lot of mass change rather than having to depend upon some specialized doctor or some specialized counselor, because the resources are so less and it is expensive. So we cannot really do it at a community level without having a cost to it. If at all there has to be a translation, it has to be in the form of having these concepts in the community level. So now coming to uses, what I was talking to you about the approach from the community. Now I'm talking about how people are in different stages of drug use, how people get into it, and how do we kind of categorize it, and then how to have a protocol to treat different layers of people. Okay, now as we know in the community, so many people are drug naive. They don't know what is a drug, they don't know what is a substance, they don't know what is an alcohol. Young kids, they don't know what it is. They would have seen their seniors taking it, their parents taking it, their friends taking it, or their favorite celebrities taking it. So they may have seen that, and they kind of could have got the glamour of it, and they would have kind of wanted to try it. So, but they wouldn't have tried it. So they are in the drug naive state, but then they are psychologically getting ready because they're seeing it here and there. They're seeing it in the movies, they're seeing it in the neighborhood, they're seeing it as a very glamorous thing. So they are in a psychological readiness process. Okay. Now this is our best time to catch them, so that when they are in that stage, if you can catch them and then if you can help them out, it will kind of create more impact. The early immigrant people who are in the experimental stage, in the sense because of the peer pressure or because of somebody forcing them, they are able to they kind of experiment with it, like the smoking. Okay, take a cigarette, take a puff of a cigarette, drink alcohol, or why don't you try this drug, and things like that. They are the early immigrants. They're the very experimental users. So more 80% of the experimental users do not really like it. They do not like it. But because of some of the maintaining factors, like say peer pressure, or let's say some stress or the personality issues, they get into the usage to an abuse state or a harmful use state. They start taking it a little more than necessary. They start using it whenever they get an opportunity. Now they slowly start lying, they start stealing, they start hiding, and then all of that starts. That is a stage of abuse state or a harmful use state, which is also a very treatable condition, treatable state, where we are still, they are able to kind of get into some kind of a recovery. And then next stage is the stage of dependency, where the most of the symptoms starts wherein they are mostly thinking about substance, like they're craving for a lot of substance, they are not getting the same enjoyment like before, they want more and more. Once they stop the drug, they have withdrawal symptoms like headache, vomiting, giddiness, tremors, seizures, irritability, aggression, and all of that. And there is a resistance, meaning they are not able to, they are not getting enjoyment anymore. They kind of keep increasing the dosage and stuff like that. So they are getting into the stage of dependency. This is when they need medical attention. And then they go into the complications of it, like they have all physical symptoms like liver damage, brain damage, muscles are gone, heart problems, and multiple problems they start with. And of course, there's a lot of social damage, like families destroyed, financially they are into problem, legally they are into problem. They're even getting into the stage of getting into prison. They kind of have physical assaults, they get into murders and all sort of crimes, and then they are into prison. So there's from the drug naive stage to the stage of complications, there are different layers, and we need to have different protocols to deal with the different stages of this. As I said, there are different complications like association. All of us know about it, how drug can increase crime. We all know it. Drug can increase suicide because unemployments are high, financial problems are high, isolation and loneliness is high, so they can commit suicide. The risk of suicide is much more greater in people with a substance abuse than without it. And death due to the complications like seizures, liver damage, Wernicke's encephalopathy, and all the other complications. The premature death is extremely common in people with drug abuse. And of course, there's a lot of financial loss, social stigma, isolation, which comes with it. So that is something which we are all aware of. So what are the factors which we need to be, which can cause a drug abuse or which can protect you from the drug abuse? So socially, the determinants which can increase the possibility of drug abuse is depending upon the quality of education an individual has. Now, that's a very contradictory statement. Nowadays, we see the more educated, the more drugs. Less educated, also more drugs. So education does not really mean degrees or the colleges they come from. Education really means how much they have learned about it, what kind of wisdom they carry, what is the kind of learning and what kind of a culture they belong to. Peer, what kind of a friendship they have, what kind of a crowd they come with. Media influence, like social media has a huge influence because it has completely increased the accessibility to the drug, and that has made it even more worse. Many a times, drug is seen as a status symbol. Nowadays, okay, now you take a drug, you take a cannabis, that means you're a cool person. And if the parents are allowing the children to take drug, that means they are cool parents. They're very friendly and very nice. So, nowadays it has become the languages and the narrative around it is so much changed that if you do it, you're good. That kind of an approach is starting. And occupational hazard, many specific occupations are more prone to take substance. Nowadays, that has become very generalized, but specific populations like corporates or people in the below poverty line working in a particular thing, and night workers, all of these are at a higher risk of getting into substance. Stress factors, definitely. The more the stress, the more the possibility of a substance. Comorbid illness like diabetes or somebody has some other cancer or anything which is causing like mood disorders, psychiatric illnesses like anxiety disorders, mood disorders, personality disorders. Many of the anxiety personality disorders are more prone for substance abuse because sometimes they cause relaxation of anxiety, so that can help them. And one of the protective factor we have is religion. If you look at the statistics, the mental health issue, substance use issue, Muslims are at lower level, and that is only because of our religion. It is a protective factor. Many of the Muslims do not take, but it's very sadly we see that now we are also going higher in rank, and Islam is no more being a protective factor. But till now, the statistics says because of religion, people do stop taking substance. So that's the good news, and it's our entire responsibility of all of us to maintain it, and our number should be the last. That's the approach with which we need to look at this. So who can be better? Let's say now, who can be better and who cannot be better? One of the protective factor is definitely comes from the family and the individual. Somebody who has the willingness, who has the readiness to change, they will become better. They should have from inside that I want to change. I want to become better. I am willing to go and talk to someone. I am willing to take help. They have a better possibility of improving, and this will come from family, because family needs to keep talking about it. Friends needs to keep talking about it, and then we have to give positive affirmations to them. We have to talk positive to them. This is okay, fine, you come back. We have to call them back to us. The more we show them connection, then there will be recovery. The treatment for addiction is connection. If we have a good connection with them, humanly, spiritually, socially, as a community, the more we create connections, addictions will go. That's the logo we need to follow. Of course, if at all an individual has a good responsibility and affection towards the family, that can pull them back. Good support system around, and individuals who have the capacity to recognize their problem, accept it, and they have the ability to resolve the conflict and the problems, they are at a better chance. Okay. So, and also people who can access doctors and counselors, and unfortunately at the community level, at the grassroots level, many cannot afford it. So we need to come up with a plan where we can have a cost-effective model which is self-sustainable. That is what I am trying to present in the next slides. Yeah, and the cultural and the belief system, the mahol which come from, which discourages such use, will help. It's a protective factor. And the previous experiences, if they have had a bad experience, a bad trip, those people will probably not take the substance again. Now, when we look at I've been speaking about how religion could be a good factor, but our iman sometimes, nowadays, if you look at it, it is having multiple issues. So that needs to be also be understood when we approach our people. So sometimes our religion is used according to the convenience of the individual. They will tell, okay, only alcohol is not to be taken, but you can take everything else. Drug is never mentioned, smoking is never mentioned, so everything is fine. And our religion itself has a lot of cultural implementation now. You could see that hookah bars are everywhere. Culturally, even in some of our functions, alcohol is served. So that way, there is a lot of differences in the way our community itself is there, so which can impact the iman. They are very biased many times because 1,001 groups and fragmentation has happened, and 1,001 opinions, and the youngsters are completely confused. Our target population are young kids, right? So they are definitely biased, and they don't know. And different status of people have different opinion about Islam. Our opinion have become very selective, and these factors also should be considered before we approach spiritually. So how we can kind of look at it, and all these cognitive dissonances, we tell something, okay, we have to follow Islam, but then we act differently. We don't behave properly. We don't show them love. We don't show them any connection. We are judging them throughout, and then Islam is a very peaceful religion. So that's called cognitive dissonance. We are not really in sync with what we are saying. So these things need to be corrected before we start approaching the patient. So now how do we start? So first of all, becoming very, very aware of what's happening, that I think we have discussed. Awareness is not a problem. Everybody knows. Everybody will give you long lectures on what is a complication, what to do and everything. But then when you approach the patient, acceptability is nil, zero. They do not want to say there's a problem. So that is the biggest barrier. So how are we going to improve the acceptability among them? Adaptability to the situation and how they can change, and affordability. Of course, the cost also comes. The cost of treatment is expensive. That also needs to be looked into. Many of the people will go back to drinking, that is more cheaper than going to a counselor and a doctor. So that affordability is also a big problem in the community. So these are the areas which as a community level we need to think about, how to improve the awareness, how to make it acceptable to people, how we can adapt to a situation, how we can make it more affordable. These are things which we need to look into. So we need to build in more and more resources in the community. So instead of you always having to jump to a counselor or a psychiatrist, you should first have volunteers in the masjids. So we will have to have people who are willing to work, so that we can train more, and the doctors can train them at community level, grassroots level, create champions among the volunteers who are doing a good job, make them the leaders, the community leaders, teach them how to recognize what to do in the first step of counseling, what to do in the second. These are trainable skills. So if we can make it, we can reduce the cost. And we have to decentralize the entire process. You should not depend more on doctors and counselors. You should depend more on masjids. We have to depend more on your family. We should depend more on your, on your volunteers, community hubs and community buddies, so that they feel more belong. And then we need to come up with a community-based interventional model within the masjid, so that there is some work going on every day, like after Maghrib or Isha, there is some activity going on, so that people openly can come and tell them, I need help. Is there any volunteer who can talk to me? They can be house-to-house visits and recognize people who have problems, get them to masjid. And then you could go to a counselor or a doctor, so the recovery will become more easier. So we need to increase the access to the people, so that they have more people who remove the barriers which are there and strengthen the protective factors each one of them have, so that the recovery rate is better. So who are the volunteers? Volunteers are people who are willing to work for the community. So these are the people who are in the ground level, who are good initiators, whose intentions are clear, who have the leadership skills. Counseling skills could be trained to them by organizations who are dealing with mental health, and they should know how to de-escalate the process, meaning they should be able to talk to the family, talk to the person in charge who is the victim, and then be able to create a safe zone, and then they're able to bring into the community-based intervention model, and then a counselor should approach them. So then this becomes a more viable model, wherein more and more people will approach help, and we are kind of breaking the barrier of access. So as we have kind of categorized the different class of people, like there's the level 1 people, level 2 and level 3. Level 1 is basically the initiators who have just come into drug abuse. Level 2 are the people who are into addiction. Level 3 is already addicted. So level 1 people will not have to even go to hospitals. They just need group therapy, family therapy, masjid itself, the volunteers can do something, and then continuously remind them in every khutbah, and family is kind of involved. That itself is good enough for them. Level 2 may require camps, and we may have to introduce the medication to them. There, a doctor may have to prescribe, so that a doctor's visit once in a while to the community center should be good enough. And level 3, which is less than 20%, they require rehabilitation, where you have to admit them in a medical facility, and they need to have continuously reminded that they should stop and they have to go and join the first level after the recovery. That means they have to continuously be told about how to stop the drug, what to do, and all of that. In the community integration model, we need to kind of, after the counseling and after the the initial intervention, we have to have a pre-vocational skill building where they have a set routine, they take care of themselves, they exercise well, they do their namaz and all of that. They have a good English communication, Hindi communication, and then we move on to a vocational skill development where they know how to use a computer, where they have some other skills, and then skill building is done depending upon different skills. We could approach all the organization which is Muslim run and help them, place them, build their personality and employ them. More they are employed, more they build their personality, more skilled they are, more scheduled they are, more organized they are, less is the possibility of a relapse. If we do not build them into a good person, if we do not give them an economical independence, if they do not give them a skill to sustain themselves, they are bored and they can go back to the drugs. So the only way we can prevent relapse is economical independence and a good amount of spiritual growth, where they know their Iman well, their Islam well, their employment well, their responsibility well. That's the only way we can prevent the relapse, along with medication. So the way to prevent the relapse is to accept them, motivate them, include them in yourself, empower them, engage them, enlighten them, and encourage them. So you have to keep on encouraging them, talk about it, engage them in activities, motivate them, accept them as they are. Then we can prevent the relapse with good amount of spiritual growth and good amount of economical growth, and then good amount of personality development. These things should happen when they are in the recovery stage. So for the recovery, there should be Iman in the middle, and then the family should be connected well. Once the family is connected to the person, they become good community builders, they become good national builders, and then they become a good peace. They can bring in peace to the world. So without an individual's readiness, without Iman, without a family's involvement, without a community involvement, it is impossible to solve this problem. We can only talk about it, but we cannot really make any difference. So some of the contributors of substance use among people are, they're disinhibited, means they do not have the inhibition control, they do not have the impulse control, they don't know when to stop it, they don't know the proper judgment, and because of the acute use or a chronic use, the judgment power is gone. There is psychiatric comorbidity and other stresses. So we need to keep recognizing all these, and also along with the community management, this also should be medically managed. So you have to have a screening and the attention to these things. So next slide. So this is next slide. Yeah. So so one of the things which can bring in a good change is a self-care, financial empowerment. People should know how to create boundaries and assertive training, ability to tell a no whenever required, effective parenting, having a good parenting style, establishing a daily routine, and after recovery, having a center and the community group which will help them. So these are things which we have to bring in every individual. Self-care, financial empowerment, boundaries. That means you can't do everything. There has to be a safe space for yourself. Telling no and parenting should be given a lot of importance. Daily routine should be given a lot of importance, and support groups should be given a lot of importance. This at a family level will bring in a good amount of change. Yeah, I have not touched upon what each drug does and what are the different type of drugs. All of that probably can come in your question answer session, because I felt it is more of medical thing. If you want to know particularly about any drug, you could ask me in the question answers, because I was only focusing on the community intervention. So if you have any independent questions on particular thing, you could ask me in the question and answer. Thank you for the patience.